In July 2009, one-time Celtic cult hero John Hartson became gravely ill. Testicular cancer had spread to his brain and lungs. John underwent an emergency life-saving brain operation and remained in the care of neurosurgeons. John has little recollection of these events.
I can't remember much about those 3 to 4 weeks, if you like, because I was pretty much out of it. It's only until you start, you know, getting into the nitty-gritty of it that you start to learn this could really, you know, this could finish me off.
Following a second successful brain operation, John was taken off the critical list.
I can remember sort of laying back and you know, nurses fiddling with me and playing with my different tubes and putting stuff in my nose, and I was getting fed through a drip, and that's why I lost so much weight. I had a tracheostomy fitted in my throat as well, which I've still got a little scar there. And I think it was when the tubes started coming out, you know, the catheter came out, and then the thing off the nose came out, and then the tracheostomy came out, something else came out, and it was just, at one stage I had just one tube. I've still got a tube there, which takes my bloods. So it was when all the tubes started coming out, I started to feel normal again, you know, and I was without pain. When I was sitting up in the bed, and then my parents would come in, I'd have a conversation, I'd have a cup of tea. So after about 3.5, 4 weeks, but I think I was pretty much out of it for about 3.5 weeks.
On the 11th of August, John was allowed home. He missed baby daughter Lena's first birthday. It fell on the very same day he received his first life-saving brain operation. Lena will soon become a big sister.
We've been trying for another baby for about 7 or 8 months, and it's just sort of strange that it's almost the week before that all of this happened. We discovered that we were pregnant, so we were obviously over the moon about it, and you know, told everybody the news, and then literally, you know, as I say, a week afterwards, we found out that John had testicular cancer, and not just that, that it had spread to his brain.
You know, you worry about leaving 4 children, and you know, your parents have been there for me from day one, really, and you know, your partner has been up the hospital pregnant, you know, sitting on your bedside waiting for you to wake up and, you know, pressing your hand and things. You worry about people who you maybe leave behind, and, you know, people who've always been there for you, really. You know, they are the people that matter.
John needs to continue attending hospital regularly for courses of chemotherapy. He's often accompanied by his mother, Diane.
You're asleep, John. Go on. Yes, you're fine. You're asleep. Don't mind at all. You don't mind at all. Chat.
Well, I've had 3 sessions of chemotherapy now. I go in every 3rd Monday. Starting on a Monday, finish on a Friday. I have 3 sessions daily, which last for 6 hours. So I've had 3 sessions of that. I've got the 1 session left of chemotherapy, and they aim to cure this now. That's what my oncologist told me. So the way I see it is, at the minute, is I'm in the right hands, and I seem to be moving in the right direction.
I don't think we can do much about the fatigue. It's just a matter of resting.
Yeah.
Right. The nausea, I would say it's important that you take your anti-sickness regularly. Don't wait for the sickness to build up, if you can understand.
Right.
If you wait for it to build up, it means then you're having to sort of take more.
I haven't actually had a conversation with the powers to be, if you like. My family have done all that, and they sort of fill me in a little bit on what's been said, but I haven't actually had a one-to-one sit-down with my oncologist yet, but that'll certainly come within the next 3 to 4 weeks. You know, I know it sounds cruel, but if you've got a week to live, or if you've got a month or 6 months, then they tell you, if you've got 6 months, they ain't going to say you've got 3 years, you know. So with all due respect, they're very, very abrupt, and they're upfront, and that's how I like to deal with people anyway, so.
John's doctor is following levels of a protein called HCG. High levels in men are indicative of testicular cancer. At the time of his diagnosis, John's readings were off the scale, but have now greatly reduced.
It peaked to exceptionally high levels, 180,000
in your case at the time of starting your chemotherapy, and then it's come down quite dramatically. And it's now reached 200, which is not yet normal.
No.
But I hope to see it normalizing in the next 2 cycles. He was an exceptional type of patient. He's fighting very bravely with this difficult condition. And he's having chemotherapy at the moment, having undergone surgery, as you know, at the beginning. He was quite poorly when he presented, and we were very worried for him. But I'm now more encouraged by his progress. I just want you to see this because
That's good, please.
it's encouraging.
Please, John.
Thanks, Doctor.
I'll see you Monday.
Thanks, Doctor.
Yeah,
Cheers.
bye.
Diolch yn fawr, thank you.
I am positive, but you know, you do want to get the treatment out of the way, and you know, you want to get the messages of all clear, you know, things like that, I suppose, which I think most people with cancer will tell you the same, you know. So as much as I am trying to stay positive, and I will remain positive as I can be, there is always that, you know, little 5% element of doubt in the back of your head that maybe tells you then, well, you know, maybe it's gone too far, or maybe it's spread too far, and words like that I don't particularly enjoy using. But as I said to you, I am a realist, and I think you have to look at all aspects. I hope for you know, for everybody's sake and my own sake, that, you know, I make a full recovery. You know, as I said to you, I've got 3 beautiful kids, 1 on the way.
John has been